Can kids follow a meat-only meal plan safely? Have you ever wondered if kids can safely follow a meat-only meal plan? This question is quite important, especially for parents considering different dietary options for their children. A strict meat-only diet, known as the carnivore diet, is not commonly recommended for kids. This is mainly due to their unique nutritional needs as they grow and develop. While some parents and practitioners look into a carnivore-style diet, it often includes high-quality animal foods like meat and eggs. This approach is sometimes called ketovore or super carnivore. In these cases, most nutrition comes from animal sources, but there may be occasional plant-based treats. Children's nutritional requirements differ from those of adults. They need essential vitamins, minerals, fiber, and other nutrients that are typically found in a more varied diet. Meat does provide plenty of protein, fats, and some micronutrients. However, there are concerns about potential deficiencies in vitamin C, fiber, and certain phytonutrients that are usually found in plants. Therefore, a strict carnivore diet for children should be approached with caution and ideally under medical supervision. In some situations, a meat-only diet might be used temporarily for children with specific chronic illnesses or food sensitivities. In these cases, eliminating plant foods can help manage symptoms. Parents who try this often notice that their children can self-regulate their intake and tolerate small amounts of plant-based foods without issues. There are potential benefits to a carnivore diet for kids, such as reducing exposure to processed sugars and carbohydrates that are common in standard diets. Advocates believe that a meat-based diet can support metabolic flexibility and overall well-being when managed carefully. However, there are risks involved. There is a lack of long-term studies on the safety and effects of a meat-only diet in children. Nutritional balance is vital during childhood, and removing entire food groups can lead to deficiencies if not planned properly. If parents decide to try a carnivore diet for their children, it is essential to focus on variety within animal foods. This includes different cuts of meat, organ meats, and eggs to ensure a broad spectrum of nutrients. Regular monitoring of the child's growth, development, and health markers with healthcare professionals is also crucial. From the perspective of the carnivore diet, children can thrive on a meat-based diet if it is high quality, nutrient-dense, and tailored to their needs. Flexibility to include small amounts of non-meat foods as needed is also important. This approach aims to remove processed and carbohydrate-heavy foods, supporting health and metabolic function. While a strict meat-only diet for children is not standard nutritional advice and carries potential risks, it can be implemented safely in certain contexts with careful planning and medical oversight.